My name is Rana. I'm 57 years old. I'm right at my 6th month. I had the neck lift and the lower face lift. Yeah, so my main concern was my neck. I felt that it had just gotten really full and it wasn't super crepey. A lot of people have crepiness, but I had more like fullness in my neck. And so I started to think and ask around about different surgeons in Denver and scheduled my consult with Dr. Weber. I first heard about Dr. Weber just from a friend who had heard his name. This friend hadn't used him, they had just heard about him. And I did speak to several other doctors in town as part of my research process before I decided. So I talked to 4 people altogether over the course of about a year, maybe even longer. And there were just several reasons why I chose Dr. Weber. First of all, I just felt super comfortable with him and his approach. I felt like he spent a lot of time with me answering questions about specific concerns I had. I felt like he didn't try to sell me other procedures that I really didn't want or felt that I need at the time. He was very supportive and focused on kind of what my concerns were. And so it felt very individualized, and I loved that the procedures I was looking for, he wanted to do in his office without the whole anesthesia, the whole general anesthesia. And it just seemed like a really comfortable setting to have the procedure done in. Yeah, so I was thinking about it. I really felt like, for me personally, I got to about age 54 and things were pretty okay. And then around 54, I just started really noticing the neck, first of all, and then the jowls really started to bother me. So I'm not really an early adopter of doing things in the world, but once I started doing the research and talking to these different doctors over the course of about a year, by the time I kind of had done my research, I really felt like I was ready to do it. So it did take me a while, and I think from what I read, that's pretty normal because it's a big decision, and I felt like that was the pace that I went at, and I didn't ever feel pressure from Dr. Weber or hurry up and decide kind of thing. I felt like it also was a very patient and understanding environment for that. And also I did feel like I was a patient that I checked in a lot with Heather. I had various questions that came up, various concerns, and it was always very responsive, when I had questions about things along the way before I actually committed. And even when I scheduled, I think I got the flu right around that time, I think in February, right before. And I was really kind of anxious about having that when I was still, I was recovered from the flu, but I still kind of was anxious. And so I really felt she was really helpful, kind of coordinating with my doctor and what I was, what symptoms I was having to still make sure that it was a safe thing to do. So that felt really, really nice also. The day of, my sister brought me, and she came here from out of town to help take care of me. It was, I think we arrived in the morning, 8:30, not super early. It was really comfortable in the setting, kind of in the prep, where I took the medications and just kind of relaxed before the procedure. It went right on schedule as far as what Dr. Weber had told me. I think we were finished around 12:30. My sister took me home, put me in bed. Yeah, and it was pretty smooth as far as, that transition back home. And then I just kind of relaxed, and the recovery really went pretty much as I'd been told. I was surprised by, I think every person has their own experience, but I really had a lot of bruising in the neck. And I think I was kind of surprised with the head wrap that, how tight it really was. And I think I had some additional bruising from that. But during the recovery, I think it was a weekend. Did we do it on a Friday? I'm not really sure. I feel like it was towards the end of the week. And then over the weekend, I did reach out one time, and the PA contacted me back right away. I said I was kind of concerned about this particular bruise on my neck and sent her pictures. She responded, and I really just felt really well cared for during that recovery process. As far as the results go, I've been really pleased with it. I feel like it's very natural. I just really look like myself like 10 years ago. I haven't really had anyone ask me, did you have a facelift? I have had people just comment with things like, you look great. Did you change your hair? Or did you lose some weight? Like, you look so good. So those kinds of comments, and that was exactly what I hoped for. I just feel good. I just feel like myself. I feel like I said, myself 10 years ago, as far as when I look in the mirror, I have gotten a lot, personally, I don't have any embarrassment or shame around having a facelift. So, I don't go around telling the world, but when people ask, I have had quite a few friends that I've told, and, people are just interested. And I think it's been that's really been positive for me, because I'm proud of my decision to take care of myself and do something that I felt, that I wanted to do. I would say, as far as advice for others, I was really, one of the things I focused on was when I was kind of doing my research and talking to other doctors, I really wanted someone who specialized just in the face. I didn't want someone that operated on some other body part that morning and then on my face. So I really honed in on that. I think that really shows, dedication on the part of the doctor to to kind of a craft that he has. So I really focused on that. And I would say ask around and talk to different doctors. And it's not really easy to compare apples to apples, but also to just trust your gut. And, if a doctor just doesn't rub you the right way, don't feel bad about that. Just keep searching, and I think you'll end up with really good results. Yeah, I would really recommend Dr. Weber. Just his personality, his bedside manner, his real care for his patients really shines through. And that goes to all of his staff also. They all seem to really, care about you and want to know how you're doing and what's your personal experience, because it is such a personal decision. And I would say the pain level that I had was very, very low, very tolerable with just Tylenol. And I would say, as far as fear about pain, I think that was really less than I thought it would be. It's more of a discomfort. But I think when you set your mind to doing something like this, you'll be really happy with the results you get with Dr. Weber.